So my name is Sadat Iqbal. I'm the outreach coordinator at Lower East Side Harm Reduction Center. Lower East Side Harm Reduction Center is a syringe exchange program in Manhattan, Lower Manhattan. We started out as an underground needle exchange program through ACT UP, and in 1992 we became one of the first legal syringe exchange programs in New York City. Since then, we've added considerably the services that we offer to our participants, as our participants' needs have shifted or changed. And most recently, one of the needs that was presented was youth services for young people. So my presentation is on the implementation of the Street Smart Debbie at the Lower East Side Harm Reduction Center. Next slide, please. This is kind of a rundown of the agenda. In the interest of time, I'm going to go over some of the things, but some of the general themes that I want to address in my presentation is the changing terrain of harm reduction, as embodied by the youth that we serve. How we implemented Street Smart here at Lower East Side and kind of adapted the CDC curriculum to fit the lived experiences of young adults. And the intersections between public health and social justice, and also some of the tensions that exist there. Next slide. So like I said, we started out as a syringe exchange program in 1992. In 1992 in New York City, 1 out of every 2 induction drug users were HIV positive, and now that number is closer to around 9%, which speaks to how effective syringe exchange is. Yet overall, we see that HIV infection rates are actually on the rise, and particularly within certain communities such as young adults. So these are some quick statistics from the CDC which demonstrate which communities are being impacted and how. So almost 40% of HIV infections in 2009 were among young adults 13 to 29. Within that, about 30% were YMS and colors, so young men who have sex with men. And the statistic on the bottom is really intense. HIV infection rates have risen by almost 50% among Black YMS from 2006 to 2009. HIV is such a virulent epidemic, partly because it's a social disease. So these show some of the cofactors of HIV infection. There are almost about 4,000 homeless youth on a given night in New York City. About 40% of them are LGBT. About 50% have had experience with the criminal justice system. About 50% have had experiences of physical abuse and violence. 20% with sexual abuse. And a lot of them have had history of substance use. So like I said earlier, all these things kind of impact our health. And it goes to show you how this is not just a public health issue, it's really a social justice issue. So Street Smart Debbie. I come from kind of a community organizing background. I've worked in several fields, but most recently when I got into public health, HIV prevention, and harm reduction, one of the things that I was trying to kind of struggle with is community organizing within this framework. And one of my supervisors told me we're not really community organizers, we're facilitators of change. And the kind of change that we try to facilitate is behavior change. So I kind of think of us as being in the business of behavior change. Street Smart Debbie. Are you guys familiar with Debbie's? Okay, so it's not the snack cakes. It's not the girl. Debbie stand for Diffusion of Effective Behavioral Interventions, and they're basically curriculums that are put out by the CDC that have been proven to work towards certain goals. So the Street Smart Debbie, the theory that's underlying it is social learning theory. I could read what it says, but basically, I'll ask a question. Where did we learn about sex and drugs? We learned in school. Streets, friends, sometimes porn. Yeah, so social learning theory is basically that how our environment and how our peers influence the way that we learn. And this is utilized in the curriculum because a lot of it is peer support groups where we kind of go on this journey together and help each other find out ways to be safer. The core elements are kind of aspects of this curriculum that can't be changed. So basically, core elements are to get young adults to realize how their emotions impact the actions of HIV. To be able to teach how HIV affects us and the different kinds of risks associated with it. To be able to identify that in our personal lives and our experiences. And then to work on skills, problem solving, standing up for ourselves, and practicing harm reduction. And the goals, what the its definite improvement to accomplish is that it decreases HIV transmission risk, it increases condom use, increases number of sexual partners, and lower rates of unprotected sex and drug use. And this again where kind of the tensions of harm reduction and a CDC model kind of conflict, because for a lot of our participants that went through this program, they weren't interested in stopping or curbing their use. And a lot of our participants practiced unprotected sex and had some reasons why they did it. And so we kind of adapted this curriculum to meet what our participants really needed, and that's what the bulk of this presentation is going to be about. Next slide. So implementation. I'll start off with recruitment. We recruited young adults primarily through 2 outreach sites, one in the East Village and one in the West Village. East Village, Tompkins Square Park is this park where we've been doing syringe exchange in for 20 years. But New York City has changed considerably in the past 20 years with the forces of gentrification, so the displacement of a lot of low-income people, a lot of homeless people out from these public spaces into commercial corridors like St. Mark's Place and Union Square where they use these spaces to panhandle and find work. West Village, the Christopher Street Piers, has been a home to LGBT homeless youth for quite a few decades, but again, gentrification and kind of public-private use of space and displacement of folks. But despite all these changes in New York City, young adults still utilize these spaces, and they were the most effective outreach sites. Next slide. In addition to outreach, we had a lot of special events. Next slide. So the Party on the Piers. Party on the Piers was where we set up a tent in a stroll in the Christopher Street area, and kind of brought street smart to the young adults that utilize that space. We had pizza, brought out the boombox, and did some common demonstrations, which were a lot of fun and helped to recruit young adults into our program. NYC Pride March, always a blast, but in the past couple of years it's been much more meaningful because we have quite a community of LGBT youth that we now serve. The picture in the lower left corner is actually a sign-making party that we do every year where the youth help us design messages that we display pride. Personally, my favorite is Lamb Bam. Love this time of AIDS. Sustainability is something that a lot of nonprofits kind of deal with, and in implementing Street Smart, we were aware of like how would we continue to sustain this program. So Love in Time of AIDS was a fundraiser that we did, where we invited artists who are living with HIV/AIDS or have been affected by it to donate pieces of artwork that could be auctioned off to promote the Street Smart program. It's a lot of fun. Graduation party. After a year of doing the program, we had a graduation party to recognize all the great work that our youth accomplished. It was a blast. The biggest piece of recruitment, though, was our youth leaders' social networks. Our youth leaders were the heart and soul of this program. And they brought their communities to the Lower East Side Harm Reduction Center. So MSM, sex workers, crusty punk travelers, transgender folks. Our youth leaders kind of embody the faces of who we serve. Next slide. Leadership development among our youth was very important. Our youth leaders were very key in developing our program. We selected them by observing kind of individuals who throughout the group were kind of leaders and either recruited a lot of people or stood out as people that other peers looked up to. They were exposed to a training curriculum with a focus on HIV/AIDS, harm reduction, outreach. They helped us out with a lot of special projects, including social media. Next slide. So social media, this was a really fun project that we worked on together. Basically, we analyzed all the messages that are transmitted to youth through social media and through like safer sex packets, and kind of utilized them to see what the message was and then kind of create our own messages. So these are some examples of social media that I created. The first one is targeting PMP crowds, so the party and play crowd, people who like using drugs and then having sex. And basically, the message is, it's not what you do, it's how you do. Even if you're going to party and play, there are ways that you can take care of yourself. The second one is targeting barebackers, which is a community that I will touch upon a little bit more a little bit later. But basically folks whose sexual identities are defined by not using condoms. And given the fact that this is going to be on a condom pack, it's kind of interesting because they're backwards. But basically, our thought was that folks have ambivalence sometimes about what they're doing. And so let's ask a question and kind of trigger those thoughts of ambivalence, which might lead to them getting tested or maybe using a condom next time. Things like that. Next slide. These are examples of ones targeted towards women. So the first one is targeting women of color and encouraging them to speak up and stand up for their values and not be pressured into something that they don't want. The second one, it's targeting lesbians. I don't know if the image quite gives it, but on the flip side of it would be messages about using safer sex supplies for your toys, and also things about empowerment, messages like that. Our interns, our youth leaders are amazing individuals, and they dream big. So this is a quote from one of our youth leaders that wants to start a syringe exchange in a city that needs it. And our internship program was designed to kind of equip our interns with the skills and experience they need to go on to get positions within the field, and a lot of them did in fact. Service delivery. All right. One of the biggest things that we had to do was adapt our curriculum. Like I said, the CDC set out some goals that really weren't the goals of a lot of our young people. So I'll give you some examples of some of the things that we adapted. Session 3 of the Street Smart curriculum is on safer sex demonstrations, how to use condoms and dental dams, which is all fun and good. But one of the questions that I love to ask our youth is, when it comes to oral sex, do we always use condoms or dental dams? Right. So then we would go around and like share harm reduction tips if you're gonna have oral sex. So for oral sex on a guy, it's like, do we brush our teeth before we have oral sex? Not good, right? Or like, are we gonna spit or are we gonna swallow? They're actually they're equally effective, it's just you don't want to let it linger. And another thing that people always enjoy demonstrating is the harmonica method. So we tried to introduce harm reduction tips and tricks into the curriculum that people really enjoy. Another one is session 4, which is about drug use and alcohol. And like I said, the curriculum is kind of wanting people to stop using. But that wasn't the goal of a lot of our participants. So something that we added to the curriculum is we went around, talked about our drugs of choice, and then shared harm reduction tips and tricks for each of those drugs. So for example, obviously with injection drugs like heroin, needle exchange, right? Using a clean needle every time. But a lot of the other things that we got around to were how to be safe on the street when you have some drugs on you. Vast majority of arrests for young people in New York City are for marijuana possession. So like, what are like know your rights kinds of tips and tricks that people can practice harm reduction and use drugs as safely as possible? The last session of the Street Smart curriculum is about unprotected sex. And basically it's about slips happen. Sometimes we don't always use protection. How can we handle that? And what are the rationalizations that we use to rationalize unprotected sex? We've lifted around and asked participants, what do we get out of unprotected sex? A lot of people have it. What are the things that we get out of it? Which brought about a lot of interesting discussions, some of which I'll touch upon a little bit later. But Street Smart happens all over the country. It happens at a bunch of agencies in New York City. But I felt like there was something that made our Street Smart a little bit special, and it was the fact that we adapted it and added all these kind of harm reduction aspects to it. Next slide. All right, outcomes and findings. So apparently I'm really into data, and this was a lot of fun. Pre and post tests are really boring for a lot of participants and also for some service providers, but it shows you some really interesting things. So this is what, after the pre-test, after the post-test, what we found, that there was an increase in intention to practice safer sex. Attitudes towards safer sex increased, understanding of the relationship between substance use and sex increased, and general knowledge. Next slide. But that the intervention affected different communities differently. It was most effective for sexually active heterosexuals, MSM, and transgender individuals. It differently affected lesbians, substance users, and barebackers. So for lesbians, oftentimes the focus on safer sex and condom demonstrations was not that relevant for a lot of our women who attended the program. But that's not to say that they didn't get anything out of the program. They really enjoyed talking about relationships and kind of like power dynamics and how gender and sexuality plays into that. Substance users. If you guys are familiar with crusty funk travelers, a lot of them are substance users. And they love talking about drugs, not so much about sex. Although a lot of them are in intense relationships. And so maybe it's just about kind of creating the right kind of cultural environment where they open up about it. Barebackers, very interesting. So there were certain individuals who self-identified as barebackers, and folks who basically defined their sexual identity by not using condoms. And so for barebackers, the focus on safer sex and condom demonstrations was not that useful. But that's not to say that they didn't get anything out of it. We talked a lot about harm reduction for barebackers, accepting that desire non-judgmentally, and then giving advice such as getting tested with your partner, building up communication, and kind of negotiating when you're ready to take that step. But these were some of the outcomes of findings. Monitoring and evaluation. So we have this event called Sex Plus, and basically the idea is sex plus everything else in our lives, all those kinds of like oppressions that affect us. And what we want to do is gather data on our young adults and their attitudes and knowledge and behavior, but in a fun way. So what we did was kind of fun activities that actually gave us a lot of data. So you see a Wordle right here, right? They're usually used on blocks. This was from an activity where we asked youth what are their needs, and we gave them sticky notes, and they posted them around the wall of the room. And then at the end of the day, I kind of looked up all those sticky notes and put it into a Wordle, and the different words and how big they are represent how many different people saw that as a need in their lives. Next slide. And this was an activity where it's agree or disagree. So one side of the room is agree, one side of the room is disagree, and where do you stand on that line? And this was where I tabulated the data and kind of saw where people stood on that line. I'm still kind of analyzing the trends of this, but it was much more fun than filling out a critical step. Next slide. New needs, new programs. So Street Smart was an incredible opportunity to gather a lot of data on what our participants needed. And these are two communities in particular that have very specific needs that we can help out with. And so this is actually new programmatic directions where LESHRC wants to go. So for transgender individuals, building up a program that centers around peer-delivered syringe exchange, information on transitioning gender, care coordination of hormone therapy, case management needs such as ID change, and then job readiness employment programs. For crusty punk travelers, it's again peer-delivered syringe exchange, Narcan overdose prevention, hepatitis C testing, and substance use counseling. Next slide. And apparently I'm really into data because like it was so much fun. We got this mapping program to help us out with outreach where we kind of targeted where do we bump into our participants and what kind of trends does this show us. Next slide. And this where from all the data that we collected from the youth program, we kind of took out just the folks who identify as travelers and crusty punks and see what their needs are. So almost all of them, well, 75% access syringe exchange, and a lot of them use a lot of substances. Next slide. And needs. So food and healthcare are immediate needs that travelers expressed. Housing and mental health, not so much. Some of this has to do with cultural aspects. A lot of travelers don't like the shelter system and are not interested in permanent housing. But these kind of gave us the direction of where we could grow our programs based on the needs of the young people we bumped into. Closing thoughts. Okay, so this is the last activity that we do in Street Smart. It's called the web. Basically, you start with a ball of yarn or a ball of fabric. You throw it to a person next to you, and you tell them what you learned about them and what you appreciate about them. And it keeps going across and across and across And so you have this amazing web that ends up. And basically, it demonstrates all the connections that we built. All the support